Some family members may become violent upon hearing the news. It's important to keep the family members and your staff safe in such a situation, so don't go alone. Provide information in small amounts. They will only be able to handle bits and pieces at a time. Be sure to use appropriate language to convey your support. Even though we may have the best intentions at heart, our message can come across as insensitive. For example, instead of saying, "I understand how you feel," say, "I wish it had turned out differently." Rather than saying, "It was their time," say, "This must be very hard. What can I do for you?" If you are the person designated to assist the family, use common language and not medical terminology when explaining efforts to the family. If ever you are responsible for delivering bad news to a family, remember to be clear and accurate and do it in private. You are about to play a role in one of the worst memories of a person's life. Deliver your message the right way, and you have the ability to prevent additional anger and pain from being added to an already tragic situation. It can be helpful to have more than one person deliver the news, for example, a doctor and a nurse. Ideally, family members should have the option of seeing the body. Again, this is an option, and they shouldn't feel pressured or obligated to do so. Many facilities are utilizing things such as a comfort cart to help personalize the sterile environment of the patient rooms. You should speak with your healthcare system and discuss ways that are appropriate to better help families in this traumatic time. Now let's watch 2 scenarios of better ways to explain the death of a loved one.
Beth, I got here as fast as I could. What's going on? How's Ricky?
He's in there. I couldn't watch anymore. But the social worker's been keeping me updated.
Well, what happened? What are they doing to him?
I don't know. He was outside playing, and then he came in and he said he couldn't breathe. So I called for help, and he seemed fine in the ambulance. And then when they were bringing him in, he was not responding, and he couldn't breathe again, and I don't know what's going on.
Dr. Evans, these are Ricky's parents, Mr. and Mrs. Smith.
Hi. I'm Mary Evans. I'm the doctor who's been caring for Ricky.
And I'm Martha. I've been keeping your wife updated.
How is he, doctor?
I'd like to give you all an update in private, so maybe we could find a room.
Sure, let's go down here where we can talk.
So I understand you didn't want to be in the room when Ricky was in trouble. And I know that Martha has been giving you frequent updates. But I have some bad news. Ricky stopped breathing. And shortly after that, his heart stopped. We worked very hard on him, and we did everything we could, but we weren't able to restart his heart. I'm sorry to have to tell you this, but Ricky died a few minutes ago.
Wait, I don't understand.
Did he wake up at all? Did he ask for me?
He never did wake up. But I know he wasn't in any pain, and he didn't suffer.
Can we see him?
Of course. I'll go talk to the nurses and make those arrangements. In the meantime, Martha is going to be here for you, and she'll be able to help answer any questions that you have. I'll talk to you again after you've had a chance to see Ricky. I am so sorry.
I know you must really be shocked and hurting right now. And I'm here to listen and to answer any questions that you might have. Is there anybody I can call for you? Is there anything I can do for you while we wait?
I don't know.
I can't really think right now.
Yeah. Do you want some privacy, or would you like me to stay?
Can you please stay?
Of course, of course. I'll stay with you as long as you'd like me to.
Thank you.
Yeah.
More and more, it's becoming common practice for the family to be at the bedside to witness a resuscitation. Studies have shown that allowing families to be present can actually help the grieving process. Please stress that family presence during resuscitation is an option. They should not feel pressured or obligated to stay. They should also be able to come and go during the resuscitation as they choose. Have a designated staff member with medical knowledge remain with the family at all times while witnessing efforts. It can be extremely helpful in the grieving process if they have their questions answered about what they have seen.
This is an excellent team. They've been working hard for about an hour, so she should be out soon to talk with you.
I'm Dr. Mary Evans. I've been caring for Ricky. I know that Martha has been keeping you updated, but unfortunately, I don't have any good news. You can see that we're still doing CPR, but in spite of everything we've done, we haven't been able to restart Ricky's heart. We are going to stop CPR, but I wanted to let you know first.
Wait, what? No.
No, don't stop. You can't stop.
I'm sorry, I know this is very difficult.
I understand.
Hold compressions. Stop CPR. I'm so sorry.
Can I see him?
Of course, I'll take you in.
While our focus is always on our patients, and in this case, the family of the deceased, what about us? What about the healthcare professional? We all experience both personal and professional trauma. Every person has a different threshold and range of events that can be conceptualized as traumatic. The negative outcomes from this trauma can be long-lasting. Effects can be physical, psychological, emotional, social, and spiritual. Possible examples are depression and anxiety, avoidance of resuscitation situations, hypervigilance in resuscitation situations, drug and alcohol abuse, the routinization of death, lack of compassion, and changes in worldview. We truly are the wounded healers. So, how can we take care of ourselves? In the work setting, the two main avenues are informal and formal debriefs. An informal debrief will take place within a few hours of the actual event. There is usually more involvement in this debrief because it's fresh and everyone involved is present. A formal debrief is usually 48 to 72 hours post-event. It is most helpful to involve all providers who took part in the patient's care, including pre-hospital, ED, and ICU staff. We must develop a strong, positive support system at home and work. Intentionally take time away to decompress and find a way to engage in physical activity. Exercise is extremely helpful in relieving stress and providing an outlet. Finally, be aware of your stress responses and don't be afraid to reach out for help when you need to.